Hello and welcome to Seven Sentinels. This is Grand Master class and I'm Peter Simon with you. Today we are conducting writing task. Severe lower back strain. The name of the patient is Mr. Barry Jones. We are learning how to write an OET letter. This lecture is common for all professionals. The case notes is taken from the medicine background, but lecture is common for everyone. Common lecture because the grammar we are dealing, the vocabulary we are using, the sentence constructions, everything is related to all different professionals. Right. Mr. Barry Jones, and the case is severe lower back strain. We are focusing on how to write sentences. We are focusing on how to write sentences. Yes, here we have the case notes. So we have the case notes. Yeah, this is a sample letter. Okay, now let us see here. You go through the case notes. Yeah. Go through the case notes. So, what does read? You have reading time 5 minutes. You have reading time 5 minutes and writing time 40 minutes. So in this 5 minutes, you have to read what is important and what is not important. So today's date is 30th August 2019. This will go into the letter. This will go into the letter. So suppose let us keep it here. Afterwards, we'll set. Okay. Let us just let it be here. So this is important. The date. We call this as the date. This is the second component. This is the second component. You want to see the sample letter, you will know. This is the second component. First the address, then the date. Date is the second component. You should remember, many people write date first. Many people write date first. Okay. Yeah. You're a doctor. This is the seventh component. You're a doctor at Newtown Medical Clinic. You're a doctor at Newtown Medical Clinic. So let us just take like that one. This is first component, second component, and last seventh component. Last seventh component. Let us take this one. You're a doctor. Doctor. Yeah, you have to write from this line. Where the line starts, there only you have to start. That's very important. Line. Where the line starts, there only you see. It should be straight. From top to bottom, it should be straight. Deepika. Deepika, I just renamed again, it is gone. Yeah. So fine. So this is common for everyone. Don't think that this is a particular profession. Every profession has the same thing. Remember that. Okay, date. So this is the second component, and this is the seventh component. And after date, what else is needed? Newtown Medical Clinic. Doctor at a Newtown Medical Clinic. So copy it. So it is Newtown Medical Clinic. So the name of the medical clinic is Newtown Medical Clinic. Okay. And Newtown Medical Clinic will not be in some other town. It will be in Newtown only. It will be Newtown Medical Clinic will be in Newtown. Okay. Newtown Medical Clinic, Newtown. Okay, fine. So we have got a date. We have got this seventh component. Our sender's particulars. Sender's particular. If you are a nurse, write nurse. If you are a nurse, then you write nurse. Okay, that's it. Okay. So nurse, registered nurse. Registered nurse or a medical practitioner or doctor or physician, whatever is given, follow that one. So here let us take, so nurse write as nurse, doctor write as doctor, pharmacist write as pharmacist. That's it. So these are the three lines which you got from this. Okay. Mr. Barry Jones is a regular patient of yours. That means he's a known patient. Is a known patient. Remember that. Patient is known, regular patient of yours. He is your patient. So this is a regular, okay, patient's GP, patient's GP, patient's doctor. Your Mr. Barry Jones is a regular patient of yours. So your regular patient, that means you are his regular doctor. That means known case. Okay, known patient. Known patient. Remember that. Barry Jones is a known patient. You have to know that one because he's a regular patient of yours. You can understand based on this one. Okay. So no need to write that one. Right? Is known patient to you. Is a known patient to you. But the other person, does he know him? The other person, does he know him? That you will know here. Write a letter to Miss Graham, an occupational therapist, detailing Mr. Jones' situation. So they do not know. They do not know. Right? They do not know. So try to understand here. Is an occupational therapist detailing Mr. Jones' situation. So you are writing to Newton occupational therapist. So here is some more information. So you have to address to Miss Jane Graham. So here Miss Graham is there. Here Miss Jane Graham is there. Remember that. Okay. So first line is Miss Jane Graham. So this is incomplete answer. Miss Graham, Miss Jane Graham. Full name is here. So you take the full name. Okay. It will come in the first component here. Leave the first line and write here. Miss Jane Graham. That is the first line. The next, Miss Jane Graham. Who is Miss Jane Graham? Occupational therapist. So here it is not there, but here it is there. So this is half information. So leave and Miss Jane Graham you'll take from here. Occupational therapist you take from here. Occupational therapist. And remember, you have to write capital letters in the address. Everywhere you have to write capital letters. There is no question of small letters. First letter should always be capital letters. Remember that. So, occupational therapist. Right. Occupational therapist. Right. Yeah. Yes. So, occupational therapist. The next one, Jane Graham, occupational therapist. And Newtown Occupational Therapy is the name of the facility. Newtown Occupational Therapy. So you have to write all capital letters. Remember that. Newtown Occupational Therapy. Newtown Occupational Therapy. So that's it. Newtown Occupational Therapy. Right. So what next? Next is here, 10 Johnson Street. Okay. Right. 10 Johnson Street. ST stands for street. Remember that. ST stands for street. 10 Johnson Street. Full, right in full. 10 Johnson Street. Yeah. So 10 Johnson Street. Then Newtown. Newtown. So that is done. So the address is perfect. 1, 2, 3, 4, 5 lines. 5 lines address. You have written the 5 lines address. Now you have to leave only 1 line space. So we'll move it up. We'll move it up. Right. So from top to bottom, it should be in a straight line. See here, like this from P onwards. Like this straight it should be. Remember that. So that is first two components. The first component is the address. The first component is the address. Right. So let us see here. So the first component, what are the components here? There are 7 components. The 7 components. The 7 components. So this should be there. The 7 components. Yeah. The 7 components. Okay. Right. You can just take them like that. The 7 components of an OET letter. The 7 components of an OET letter. The 7 components of an OET letter. Remember that. Yes. Okay. So note down this. Note down these points, please. Yeah. So note down these points. So these are the 7 components. Right. Yeah. This is a very special episode. So do not miss the session. Yeah. So now address, date, salutation. Now let us see the address. What are the components of the address? The name. You have 5 different things. 1. The name. Okay. So, we have seen here, there are 5 parts here. These are 5 actually. There are 5 things here. 5 things. Now, what are these 5 things? Let us see. The first one is the name, the recipient's name or the receiver's name, the person who is, so the name. Number 1 should be the name. Number 2 is the profession, the designation. The designation. Number 3, the facility. Number 4, street. Number 5, the city. So there may be different things in different letters. So don't think that it is standard. It depends letter to letter. Okay. It depends on letter by letter. It doesn't mean the same every time. Okay. Doesn't mean it is the same every time. No. Yeah. So the name, the designation, the facility, the street, and the city. Remember that. So this is the way how you are going to write every letter. So sometimes instead of the name, the designation, the department. There may be other aspects also. There may be other aspects also. Number 3 may be the department, emergency department or yeah, casualty ward or whatever it is. And the facility. It may be the facility. The next one, the street and the city. And maybe last one is the country or the state. Anything it may be like that. Okay. So remember those things. So I have just given you an example. Yeah. So let them be as usual. Okay. This is the way how you are going to do. Now next one, the date. You know, this is the date. Number 2, component number 2 is the date. Yeah. Component number 2 is the date. And component number 1 is the address. The address. Yeah. So that's it. Fine. Now, leave one line between each component. Leave one line between each component. Do not write here. One line you have to leave. After every component, leave one line. Leave one line here. Okay. Leave one line. Fine. That is very, very important. Okay. Leave one line. Then again, okay, you have to leave one line. So after every component, you have to leave one line. Right. That's it. So do not forget this. It's very important. Leave one line. Next one. What is the next one? If you want to see here, the address is over, the date is over, the salutation. Salutation, dear doctor. Like so, if you take here the salutation here, dear Miss Graham, comma, dear Miss Graham. Okay, dear Miss Graham. Yeah, yeah. Dear Miss Graham. Dear Miss Graham. Yeah, dear Miss Graham. And you say, comma. Dear Miss Graham. And say, comma. Right. Dear Miss Graham, comma. Then again you have to leave one line. So here you will write a dear. Dear. And then first title. Then Graham. This you have to do. This you have to do. Right. Next leave again one line. Okay. Leave again one line. Right. Okay. And then leave one line again. Yeah. Leave one line again. Leave one line again. Leave one line again. Okay. Right. So once you leave the line, again you will what? The subject line. This is the salutation. This is number 3. The salutation. This is the salutation. This is the salutation. This is the salutation. This is the salutation. So after salutation, okay, once you finish the salutation, you will go for the subject line. So number 4 is the subject line. Number 4, the subject. Number 4 is the subject. Yeah. Number 4 is the subject. Right. Now what you will write here, the subject. So yeah. So subject line. Next one. Next one, you'll write the subject line here. Right. Subject line will be where you'll go for the subject line. Subject line is, you see, what is the diagnosis? This is the diagnosis. And diagnosis, lower back strain severe. Severe lower back strain. Severe lower back strain. Okay. Severe lower back strain. Yeah. Then this is the diagnosis. Okay. And the name of the patient is here, Mr. Barry Jones. Mr. Barry Jones. And next one, date of birth is this. And age is this. Okay. Right. Now try to understand. So here you will write, you are writing this letter regarding this particular person. You are writing this letter regarding this particular person. Remember that. Fine. Mr. Barry Jones. Copy text. So Mr. Barry Jones. So you are writing regarding Mr. Barry Jones. So regarding. Okay. Regarding Mr. Barry Jones. Regarding Mr. Barry Jones. Fine. And then you'll put a comma. You'll put a comma. Then again you'll write there are two things here, date of birth and age. Now which should you write? Both you can write. But when both are there, better to write the date of birth. Okay. Okay. So date of birth 11 June. So here you put D capital letter, O capital letter, B. Date of birth, colon 11 June 1973. 11th June 1973. This is the way how you have to write. This is the this is the thing you can think regarding Mr. Barry Jones, date of birth 11 June 1973. Then again you will leave one more line. Again you will leave one more line. Right. Then leave one more line here. Leave one line here. That's it. Leave one line here. Okay. So leaving one line. So this is the way how you are going to follow on a daily basis. So now you have gone through the address. Okay. This is the address. So in address you have 5 points. The name, Jane Graham, Miss Jane Graham. The designation, occupational therapist. And the facility, Newtown Occupational Therapy. And the street, that is 10 Johnson Street. And then the city, that is Newtown. This is the way how you are writing. Next one. Leave one line after the first component. After first component, leave one line. Then you'll write the date, 30 August 2019. Then you'll write the salutation, dear Miss Graham, that salutation. Then leave one line. Leave one line. Then regarding Mr. Barry Jones, date of birth, 11 June 1973. So this is the way how you are going to write. Fine. So these red marks, danger zones, don't write these areas. Red marks, this red color is danger zone. Don't write in that line because they are the dividers and separators. They are the dividers or the separators. That's it. So for these are called the preliminaries, or you can say the starters. These are the starters. We have three different things. The starters, okay? We have three different things. So what are the three different things? The starters. So when we go for dinner, we have three different things. The starters, then they say the main course, and the desserts. Yeah, all right. So so let us take the starters, the main course, and the desserts. If you take these three things, okay, let us take these three things here. Now, the first four, okay. The first four, you can say starters. Okay. So these first four things we can take as starters. Starters. Okay, we can separate these as starters. Right. Then the last two are called the desserts. And this is the main course, that is the most important thing. Okay, this is the main course, which is the most important thing. Yeah. Okay, something is going wrong. Okay, fine. Okay, so the main course, we can take it as main course. Color. Okay. So let us take the main course here. This is very, very important. Okay, this is very, very important. So, right. So far, so good. Now we are entering into the main area. So here, this is the main body, the body of the letter. Okay, the main course, that body of the letter. You start from here after leaving a line. So the body of the letter, the body of the letter. Yeah, the body of the letter. So this body of the letter, you will write. Let us take the body of the letter. So you can say 5 paragraphs you'll write. Okay. So the body of the letter, let us take here paragraph. It's the body of the letter. Start somewhere here. The body of the letter. Now this you can write in 5 paragraphs. First one will be the introduction, like this. Okay. So the main problems, the other important problems, the discharge problem, the conflict, all these things will come here. So 5 paragraphs. So let us take paragraph number 1. Paragraph 1. Then paragraph 2. Just I'm going to show you some sample, that's all. Paragraph 3. How your paragraphs look like, that's all. Paragraph 4. Okay. Paragraph 5. So this is how you write 5 paragraphs. And after every paragraph, you leave one line. After every paragraph, you will leave one line. Remember that. Okay. So you leave one line. Yeah. So after every paragraph, you will leave one line. I'm showing you the rough idea. Okay. Right. So this is how the paragraphs are constructed. Leave one line after every paragraph. That's it. Paragraph finished, leave one line. Then next one is the leave taking. Leave taking. What you will say? Now you know you are writing to Miss Jane Graham, so you have to write yours sincere. Name of the person. The name is there. Then if name is not there, how you have to write? If name is there, how here the name is there. See the name is there, Miss Jane Graham. So you have to write yours sincerely. Yours sincerely. Yours sincerely. So yours sincere. Yours sincerely. So that's it. Now again you leave one line. Again you leave one line. That's it. Okay. Yeah. So this is the pattern. This is the pattern. This is how you are going to do. This is the pattern, and this is how you are going to do. So paragraphs you are going to construct afterwards. Now, after you are sincerely, then what you are supposed to do is you have to leave another line here. 2 lines you have to leave, especially here. Okay, 2 lines. So here you are leaving 2 lines. Yeah. So 2 lines you are leaving here. Because here normally you will leave one line and there will be a signature. So you're going to write your signature or a name, your name or something which is missing. So 2 lines. Why I told you, I'll show you example. You may be thinking why sir is telling like that. See here. So see here, double line. From here to here, double line is left. So this is how you have to leave. This is how you are supposed to leave. So part A is done. Part A is done. What is that? Other than body, everything is clear. Other than body, everything is clear here. Yeah. So So all the things are here. So this is the date, this is your address, and this is the name of the patient and the age. Okay, and this is the diagnosis. This we'll write afterwards in the introduction. Okay, and here the address. Okay, that's it. So far, so good. Right. Is everything clear? So for what we have explained, is everything clear? Say yes or no. So all of you first think about these things. Then afterwards we'll learn about body paragraphs. Yeah. Yeah, if you have any doubts, you can ask me regarding other than body paragraph. I did not teach body paragraph now for this letter. Other than body paragraphs, everything is clear. If you have any doubts, you can ask me now. Yeah, if you have any doubts, you can ask me now. Right. So this will go up. Okay. Sheenam, wait. Sheenam, please wait. Okay. Yeah. So this is the way how your letter looks like. Okay. This is the way how your letter looks like. Yeah. Now you can see everything there. This is how your letter looks like. So the orientation of the letter. Yes. Hope you understood everything very clearly. Right. Right. Yes. So, right, Dr. Shabnam. Dr. Shabnam. Yes. If you are comfortable, you can share your voice, unmute, and speak about whether you understood everything. Is it clear or not? What is the difference in this style, and how better it is? Yeah, as a doctor, you can just share your viewpoints if you are comfortable. If you are busy, it's okay. Yeah, I'm asking the old students, right? And yeah, yes. Next one is Sukhwinder Kaur. Hello, Sukhwinder Kaur from Amritsar. Hello, Sukh. So you have any doubts, you can talk. Whatever you understood, you can tell. Share your opinion regarding this particular session.
Good evening, sir. Good evening, sir.
Yeah, good evening. Carry on.
Yes, sir. Sir, yes, you given this organization of letter in a very organized way, that how we write, how we start and letter in a very smart way, and you give you have given each and every point of the letter. You explained each and every point of the letter, and we we got all clear, a crystal clear picture of the letter after viewing this page, that firstly what we have to write, and then the ending point of this, that sincerely, yours sincerely, and all that. So thank you very much, sir, all that, for giving me this picture.
Okay. Yeah. That's fine. Thank you very much. You can mute back. Yeah. Nobody will open the videos and nobody will open the audios without my permission. So, and follow those things which I'm telling you, because I know I'm planning accordingly. No hurry. Okay. Just follow my suggestions. I am the commander, and whatever I am telling, follow those things for your own benefit. Okay. Next one. It's okay, Shabnam. Right. Now we have the second part of the letter. Second part of the letter. Second part of the letter is the body of the letter. Okay. Second part. This is the first part we have seen. And now the second part is the body of the letter. The body of the letter. Okay. Yes. You'll write in 5 parts. 5 parts. Okay. Right. So we have 5 parts here. It differs from letter to letter. It doesn't mean that it is the same area. Okay. In general, I am giving you, this is the general format. It differs accordingly. This is for a discharge letter, for example. Urgent letter will be something different. Little modifications, okay, will be there. Right. So the body will be divided into 5 paragraphs. Write 5 paragraphs only. Write 5 paragraphs. Now, the 5 paragraphs, this we are going to deal first with the introduction, because very important. First, we are going to deal with the introduction. Okay. We are going to deal with the introduction. So each paragraph will write in one particular page. So now we are going with the introduction. So I'm taking you to a new page. So the introduction. So we are going to write the introduction. Introduction. So introduction, how we are going to write. So now what I'm giving you a chance. So what are you going to write in the introduction? What should be there in the introduction? what to write in the introduction. What to write in the introduction. Yes. Come on. I'm giving you 1 minute. All of you, whatever you know, you can write here. What are you going to write in the introduction? What do you think you're going to write in the introduction? You just write diagnosis. Okay. Come on, all of you. I'm preparing some tea. All of you write whatever should go into the introduction. Yes, all of you participate. Yeah. Yes. Fine. So, right. Now let us see what are the components that you are going to write. Number one, the first component is the patient. The patient is the first component. And the next one is, so what is his present condition? Okay. What is his present condition? The present condition. What happened? The next one is, what type of letter you are writing? The type of letter. The type of letter. So you're supposed to write what type of letter you are writing. Yeah. Yes. The type of letter. Next one, the purpose. The purpose of the purpose. The purpose of the letter. The purpose why you are writing the letter. The reason we call it. The purpose or the reason for the letter. Okay. So I hope you are able to understand. Right? Okay. The purpose, that means the requirement. Okay. And next, what is it going to happen? Okay. What is it that you are going to do? So is he being discharged or transferred or referred? That is the type of letter. And where is he going, for example? Okay, when is he being discharged? Where going? If sometime I'm not giving you, I'm giving you different points here. Where? The destination. Where is he going? The next one is, okay, the time. The time. So the patient, the present condition, the type of letter, the purpose, the destination, the time, and anything else. Okay. Next one, last but not the least, is it back to the pavilion or not? Back to the pavilion. That means he came from home and is he going back home? Okay. So back or not? Back to the pavilion. From where he came, is he going there or is he going to some other place? That's it. So these are the 7 components that you write. Now let us see here the patient. Okay. So all these points we are bringing them here. Okay. Right. Now let us see the name of the patient. Now the name of the patient is here. Yes. Mr. Barry Jones. Okay. This is the name of the patient. Mr. Barry Jones. Right. Mr. Barry Jones. Yeah. And what is his present condition? The present condition is, okay, it was background, the diagnosis. Diagnosed with lower back strain, severe lower back strain. Okay. So present condition is diagnosed with severe lower back strain. So that is the present condition. Okay. Right. Diagnosed with severe lower back strain. That is the diagnosis. Now, how is his condition? How is his condition? Okay. How is his condition? Recovering well. Recovering well. The present condition is recovering well. You have to remember that. Okay. You have to remember that. So here there are two things. Okay. Here we have to write the stage. One more point is there the stage. Diagnosis stage is finished. Now the recovery stage is going. The present condition is recovering from. Okay. So diagnosed or recuperating from severe lower back strain, anything, whatever it is. So this is the recovering stage. Recuperating or recovering stage. Yeah, the recuperating stage. He's in the recuperating stage. He's recovering well. He has been recovering well or recuperating excellently. Right. The type of the letter. Now, what is the type of the letter here? Okay, no hurry. If anybody is in a hurry, just better go and sleep. Okay, because I want everyone to understand everything. There is no question of anything else. There should not be even a bit of doubt after writing this letter. I'm not going to teach you 100 letters. Okay, I'll teach you each one type of letter. Okay, then you can write. So, yes. Next one. So this is the recovering well stage. Right. Now, next one. The type of letter. What is the letter type you are writing? Now you are just writing a letter. So you're writing a letter. Writing letter to the OT, occupational therapist. You are writing a letter to an occupational therapist. Is it a discharge letter? No, because nothing is written here. Write a discharge letter, or write a transfer letter, or write a referral letter. Nothing is given here. Nothing. So this is not a referral letter. Okay, this is not a referral letter, right? This is not a referral letter. This is a request letter. You're just requesting for something. This is okay. So, right. So, you're requesting a letter, requesting something, that's all. Okay, you want him to do something for this person. Now, here, is it a referral letter? A referral letter will be written from a person who knows the patient, okay, to a person who does not know a patient. That's a referral letter. That's okay, because what you cannot do, he is going to do. That's a referral. The next one, transfer letter. So he is being transferred from this hospital to another hospital. Actually, here, this is what's the place? Newtown Medical Clinic. Newtown Medical Clinic. So this is a visit. 31 May 2019, 28 June 2019, 29 June 2019, 30 August 2019. So there are multiple visits. There are multiple visits. You can see that. So now this patient, you know him and he is visiting your clinic. Okay. Mr. Barry Jones is a regular patient of yours, not the first time, as a regular patient. But don't use the word known patient of yours, like all these things. No need. Okay. Then next one. So the type of letter. What you are going to write? You are not going to write anything here. So so you are requesting. This is a request letter. You are requesting something. Requesting some favor. Okay, you are requesting some favor. You want him to do what? Requesting what? You are requesting you are requesting, yeah. You are writing a letter to the requesting assessment of workplace. So this is more important. Workplace assessment. Workplace assessment. Okay, requesting some favor. He requesting the occupational therapist to access. Requesting what? Okay, workplace assessment, whether he is suitable or not. So you are requesting whether this person can return to work or not. So return to work. Work resumption. Resumption of professional resumption of work, resuming work. Okay, resumption of professional activities, we can say. Resumption of professional or rejoining work. Rejoining work. Resumption. Okay. Resumption of duties, responsibilities. Okay. So resumption, resuming work, you can say. Any way you can say. So workplace assessment to assess whether he is suitable to do the participate. Okay. Yeah. So okay, right. So now let us see there. Requesting workplace assessment, resuming work. So for example, if you do not know any words, no problem. Afterwards, we can see that. Okay. Afterwards, we can see that. You can just go to Cambridge Dictionary. Okay. And you can just type there. So just type there. Recuperating. To become well again after an illness, to get back your strength, health, etc. So there are some things which the dictionary can help. There are some things, okay, dictionary can help. So Cambridge Dictionary is very important. If you have any doubts, anytime, anybody, just go to Cambridge Dictionary. Just go to Cambridge Dictionary, and there you can just save this dictionary. Okay. Yeah, that's it. So that is dictionary link. So go to dictionary and just type whatever word you want, and it will help you, because many words we'll be discussing here, so you can learn them, right? So requesting workplace assessment, resuming work, right? Requesting workplace assessment, or he wants to resume work, whether he is suitable for work or not, what type of activities he can do, and what type of activities he should avoid. So this is a letter. So here you are just writing, no need to write everything else. Everything will go into the body of the letter. Here only workplace assessment will go, right? In the introduction. Introduction should be short and sweet. Introduction should be short and sweet. Sweet, that's all. Right. Yeah. Introduction should be short and sweet. That's it. Next one, the purpose. So this is not a transfer letter, this is not a referral letter, this is not a discharge letter. You are just requesting him to assess whether the suitability of rejoining work. Okay, you're asking workplace assessment. That means whether he can go for work or not, whether he can join work or not. That's what he is asking. Yeah. So next one, the purpose of the letter. Okay, purpose of the letter is work. So this is a request letter. Okay, this is a request letter. Yeah. So the purpose is workplace assessment. Workplace assessment. Okay. It's here. Sorry. Yeah, fine. So you are requesting him for workplace assessment. The type of letter is just a request. Okay, normal letter request. So you can think like that and you can write. So the type of letter, okay, assessment or evaluation or examination, okay, right, to find out do's and don'ts, what he should do and what he should not do. That the destination. Now here, the destination, where uh, is he discharged back or not? Okay, if he's discharged, where is he going to? So he is at home only. He did not join any hospital. He is at home only, right? So, right. Next one, the destination. So we don't have anything here. So we'll not write anything about this one. So there is nothing. And the time, nothing. There's discharge letter, a referral letter, a transfer letter. This will come there, but here nothing is coming. And is he going same place from where he came? No, he's at home only. That's what. So these are the important things that you are going to write. Okay. Now, because there is nothing here, so you can write some other points. You can write some other points. Any other things. So here, why he got this lower back strain? Okay, this is the reason for getting this problem. The reason for getting this problem. So you have to write the background story. The background story you can say. What is that background story? Background. Yeah, you are going to write the background. What is the background here? Okay, he is a forklift driver. He is a professional. His profession. You can see here, right? What is this? Something is missing, so you can add something else. Okay. Forklift driver in a large warehouse. No need to write everything. Okay. He's a forklift driver. Is a forklift driver. You can use this one. You can use this one. Forklift driver. Yeah. His work. Okay. It drives forklift. So forklift driver. You can say that. A forklift driver. So he's doing some heavy duty there. He's doing some heavy duty, a forklift driver. Then next one, after background, okay. So now here he wants workplace assessment. Why? Because he is without work for so many days. Okay. So he's on leave. He is on leave. He's on leave, right? He's on leave on a vacation. Okay, medical vacation, medical leave. On medical leave. He's on medical leave. Okay. He's on medical leave. Right. Current status. This is called the current status. The current status. Yeah. The current status is on medical leave. Okay. Right. Yeah. He's a forklift driver. He's on medical leave. Okay. Then, right. So, what was the reason why he faced this problem? He's on medical leave. What was the reason? Okay. What was the back? What was the main cause for this problem? For this severe low back strain? Okay, he's a forklift rider. This is personal background, and he's on leave. That's the current status. And next one, the reason behind. The reason behind. What is the reason behind this problem? The main reason. The main reason. The main reason behind this big problem. Okay, the main reason behind this big problem. Yeah, yeah. Shabnam, severe, severe, severe. Okay. Now here, the reason is he was actually trying to lift some heavy objects. Lifting, he was actually lifting heavy objects at work. Okay. Lifting heavy objects at work. That's the reason behind this. So this is the way how you have to write. Mr. Barry Jones, diagnosed with severe lower back strain, a recuperating stage. Okay, and what you are doing, you are requesting, and what does he require? He requires a workplace assessment. Okay, request, request. That means what it requires. Okay, requires. Request is requires. Requiring something, that's why you are requesting. Okay, that is workplace assessment. Yeah. Now, now keeping these all these points, you can write. Okay, you can write some sentences using these things. Come on, you can write one sentence or two sentences or three sentences maximum. But if you write two sentences, it's better. If you write one sentence, it is extraordinary. If you write three sentences, it is normal. If you write three sentences, you'll get B grade. If you write two sentences, you'll get B plus. If you write one sentence, you'll get A grade. Come on, write down your introduction here. Yeah. Yes, I'm giving you say 3 minutes. Yeah. Write down your sentences. Okay. So the official sample. Okay, write down your sentences, please. Write down your sentences, please. Only writing, Sheena. Shabnam, you cannot write I am like this. Okay. Habibullahi, you have to contact me afterwards. I forgot yesterday and you also forgot. Your admission is still pending. One more doctor's admission is done. So only one more doctor place is there. Write in small letters, na? Write in small letters. I cannot retype with all capital letters. Please write in small letters. Because I'll correct your letter. I'll correct your sentences. Those whoever is writing in small letters, you cannot write like this in capital letters, everything. So write in small letters. Okay, number one, Vinita Ramakrishnan. The introduction. The introduction. So number one, the introduction by, okay, Vinita Ramakrishna. Yeah. So I will correct like this one. So write small letters only. Yeah. So now let us see this sentence whether it is okay or not. Yeah. Come on, write down all. Okay, I'll keep your sentences there. Yeah. Don't make me to hurry and write everything at a time. Okay, you have to learn step by step. Yeah. Yeah. Finished everyone? Okay. Now, the first sentence I have taken from Vinitha Ramakrishnan. Okay. Now let us see the correctness of this sentence. Okay, this is the sentence which she has written. Now I am going to correct that sentence here. Right. Okay. Mr. Barry Jones. What is this Barry Jones? From where Joan came? Huh? What is the spelling? You don't know the name of the spelling of the patient. Huh? Barry Jones. Okay. Vinitha Ramakrishnan. Okay. What are you doing? Vinitha Ramakrishna. All of you write the answers. I'm not simply wasting my time here for silent people. Okay. Vinitha Ramakrishna. So you don't know the name of the patient actually. It is Jones. So that is your first mistake. Okay. How can you write the name of the patient's mistake? Jones. Okay. No need to write Barry again here because already in the introduction, before introduction, we have written here in the regarding line. Full name we have written Barry Jones. So second name is enough. Second name is enough. Swati, I will correct your letter today. Dr. Swati Nemade. After the class. Okay. Where is Swati? Dr. Swati. Yeah. Today too many doctors are there. Dr. Swati is our regular student. Hello, Dr. Swati. Okay. Are you comfortable? You can unmute. Okay. So Dr. Sheenam, Dr. Swati. Yeah, Swati.
Yes, sir.
Yeah, remind me after the class, okay?
Okay, sir.
Anytime. Don't go to sleep before getting your letter corrected.
No, sir.
Yeah. So, Dr. Sheenam, Dr. Swati, Dr. Shabnam. Okay. Right. So, right. Now, you actually do not know the name of the patient. How can you do that? Okay. How is that possible? It's not fine. It's not fine. Mr. Barry Jones. Barry, not compulsory. Not compulsory. Because you have already, it's okay. If you write, it's okay. It's not a mistake. One word unnecessarily you're wasting. That's my problem. I have many other angles. So you can use some other word which is very extraordinary. The next one. Mr. Barry Jones, who requires workplace assessment due to severe back pain. He is recovering from lower back strain. Actually, you have messed up. Workplace is not right. Okay, then what is right? Let us see whether they, yeah, how you are supposed to do. Okay, so workplace. Now see here, this is workplace. Computer is showing that it is wrong. Workplace should be one word. You have to remember that workplace is one word. So two mistakes so far. Two mistakes you have done already. So all of you learn these things. These are concepts. Okay. Is Avil there? Avil? Avil's health is not fine. Okay. Kiran Kaur. Unmute. Kiran Kaur. Hello? Kiran Delhi. Can you unmute, please? Yeah, I'm going to give you some points. Note all these points because all these points I'm going to give short videos. Okay?
Okay, sir.
I'm going to write here those points, write on a piece of paper and then type them to me or copy paste and send them to me later. Okay?
Okay, sir.
Don't forget, it's very important. Yeah. So the point here is number one, spelling mistakes. How dangerous they are, you don't know. Spelling mistakes. This is point number one. Write down, Kiran. All of you write down these points. Whether you give me or don't give, you don't give me, it's not problem. Kiran will give me. Okay. But all of them, write them because these mistakes I don't want to see from your part. Yeah. Number one is spelling mistake. This everyone does. Everyone does. For one. Number two is this girl has written Barry Jones again. So Barry, is this needed again and again? Barry Jones, Barry Jones, Barry Jones, 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 Jones. Okay. The second concept is called redundancy. Redundant. Okay. Redundant. That means the word is important or not important. This is called repetition. You can say repetition. Repetition of, okay, repetition, vocabulary repetition. That means repeating the same words again and again. Barry Jones, Jones, Barry Jones. Repetition. Is it important? Okay. Next. Number 3. Now this girl has written done another mistake. Workplace is 2 words she has written, and it is actually 1 word. Number 3 is 1. Okay. We can call it as compound or separate words. Compound words or separate words. So now here this is a mistake. This is a mistake. It's a very big mistake. Okay, very big mistake. We don't know. It's a grammatical error. Mr. Jones, enough. Mr. Jones, who requires workplace assessment due to severe back pain. Okay. So here, who is not necessary here actually. Mr. Jones requires workplace assessment. That's enough. But due to he requires workplace assessment due to severe pain. What do you mean by due to severe pain? There is no connection here. It's better to put full stop here. Okay. It's better to put full stop here. Okay. Where assessment. Mr. Jones requires workplace assessment. So comma is not needed actually here for this particular sentence which you have written. Okay. Mr. Jones, okay, requires workplace assessment. That's it. Okay. Now, due to severe back pain. Due to severe back pain, what? Due to severe back pain, he requires workplace assessment. There is no connection there. The connectivity is lost. Okay. The connectivity is lost here. Mr. Jones requires a workplace assessment. That is 100% correct sentence. Okay. That's 100% correct sentence. But does he require workplace assessment due to severe back pain? No. Due to severe, that means he has severe back pain. That's why he needs workplace assessment. If he has severe back pain, then how can he work? Then what is the need of assessment? Actually, you're telling something wrong there. Due to severe back pain, you cannot attend workplace. You cannot go for work due to severe back pain. It's a contradiction actually. There's a very big flaw in your sentence. Okay. Mr. Jones requires workplace assessment due to severe back pain. That means Mr. Jones has a severe back pain. Therefore, he requires workplace assessment. So, if he has a severe back pain, how can he go for work? What in the first place? How is that apt or appropriate? How is it that right? No way. He cannot work. Then if he cannot work, how can he take workplace assessment? Workplace assessment will be done to prove that you are fit. But you are saying due to severe back pain. That means he has severe back pain. So it is wrong. Okay. So if you want, you can say another sentence you can write. He was diagnosed with severe lower back pain. What is given? The diagnosis, you don't change that one. Okay. It is lower back strain. Use it as it is, na? Why do you want to change this word? He was diagnosed with severe lower back strain. So that is the correct sentence. Next one. He is recovering. Now, what do you mean by is recovering? That means 1 hour ago he was not recovering. 3 hours ago he was not recovering. 1 day before he was not recovering. What do you mean by he is recovering? What do you mean by he is recovering? That means now he is recovering. 1 minute before, 2 minutes before, he was not recovering. That information is not clear. Your sentence is correct. He is recovering from lower back strain. Correct. But is this happening only now? Or is this happening for quite some time? Maybe 1 day, 2 days, 3 days, 4 days after the treatment. So you have to say here, better to say he has been recovering. Okay. So either use a diagnosis or use recovery. Any one you can use. Now, from lower back strain, due to severe lower back strain. So lower back strain, this is repeated. So why are you repeating it? So instead of repeating this one, you can say he has been recovering steadily, gradually. Something you can use. No? So write correct sentences. That's more important. Okay. Mr. Jones, who was diagnosed with a severe lower back strain, has been recuperating steadily. Then he requires workplace assessment and what else, what type of works he can do and what type of work he cannot do. Okay. Suggestions. Education regarding responsibilities he can perform. That you can write. So be very careful. Okay. Yeah. 44-year-old forklift operator. Good. So these are some corrections. You can add something, you can modify some things. Mr. Jones, who was diagnosed with severe lower back strain, has been recovering steadily and therefore requires workplace assessment and counseling or education regarding the activities he can perform. Okay. You can write like that. The next one. So that is what you have written, that only I corrected. I am not adding anything. I am not removing anything. We are concentrating on introduction. Okay. Don't think that one letter will finish everything. First learn introduction. Introduction only is not right. Then how can we run for the entire letter? Slow. If you want, I can give you a lengthy lecture. No problem. We'll go through how many things possible. That's up to you. Okay. So, who is this girl? What's her name? Vinita Ramakrishna, unmute please. Hello?
Yes, sir.
All the sentences, everyone is writing, take all the notes. Okay, I will put it on the Telegram channel. I'll send it to the group also. I'll make this paper a PDF and send it to you. Write all these sentences and learn all the corrections. Okay.
Okay, sir.
Very good. You are very obedient. Very good. Thank you. Next. Next one. Second sentence. Yeah. So Sheenam Bansal, you have written very nicely, but I'm not taking that one because it is in capital letters, because I cannot write everything again in small letters. It will take time. So you have written again. I think when the line comes, I'll take yours. So that is number one. Number two. Number two. Jackson Kirby. Okay. Jackson Kirby. Fine. So right. Yeah. Now let me correct this sentence. I am writing. Why are you using a capital letter here in the middle of the sentence? Don't tell computer mistake, sir. No, you are sending it to me. It is your mistake. Computer cannot type on its own, no? You have to check, right? At least you have to proofreading, right? Without proofreading, how can you send me? I am writing regarding Mr. Jones. Who? This is a relative class. You have to put a comma. Put a relative class before a comma. Okay? Comma. So who? Mr. Jones, who? Who is this Mr. Jones? Mr. Jones is who? Who is Mr. Jones? So when you are joining this one, this is called relative clause. You have to combine, you have to use, connect it with a comma. Connect it with a comma. So the next point, number 4, is relative clause. Compound separate words over. Fourth one is relative clause. Relative clause or nouns in opposition. Those difficult words I'll not tell you. The relative clause. Mr. Jones who? Okay. Then it is not is recuperating because this is a steady process. It's not 1 minute happening, but it's a long time. So it is better to say has been. Who has been recuperating. After severe lower back strain or recuperating from pain, not after pain. After pain means pain finished. Then where is recuperating? Recuperating after a surgery, okay. But a lower back strain, okay. Who has been recuperating from severe lower back strain? Okay. After a surgery is okay. After replacement, okay. Okay. So this is a pain, headache. Okay. Headache. He's suffering from headache, not suffering after headache. Okay. So pain. He's suffering from pain. Suffering with pain. Okay. So recuperating from severe lower back strain. Okay. So then next, here again he is not needed because Mr. Jones is already here. Mr. Jones is already here. Mr. Jones is already here. Okay. I am writing regarding Mr. Jones who has been recuperating after severe lower back strain. Okay. Severe lower back strain. Okay. Someone is asking. Yeah. Kiran is asking case notes, sir. Okay. I'll give you case notes. Just to go here, na Telegram channel, and just search what is this Barry. Just type Barry and you'll get case notes. That's I already put here. See, I already put here. Okay, case notes. Copy post link. Yeah, there is a case notes. You can get that case notes here. Okay, and sample letter also is here. Yeah, right. Now, I'm writing regarding Mr. Young, who has been recuperating from severe lower back strain. Recovering from this problem, from, not recover after the problem. Problem is finished. What after recovery is there? Recovering from severe lower back strain. That's a problem. Requires workplace assessment. Yeah, fine. Okay, workplace assessment. Then Jackson Kirimi. Next one is Samni Habibullahi. Okay, so he's a guest. The next one, Simiat Abdul Rahim. Simiat Abdul Rahim. Yeah. Simiat Abdul Rahim. So this is number 3. Simiat Abdul Rahim. Okay. Yeah. Mr. Jones requires workplace assessment. He was diagnosed with severe lower back strain and has been recuperating well. Whenever you are using the word recovering or recuperating, you use has been. And then here, double spaces are there, 1, 2. Why do you leave 2 spaces? You have to leave only 1 space, okay? So second space is wrong. And here also I think 2 spaces. Why 2 spaces? Only single space. You cannot use double space, okay? Okay. Mr. Jones requires workplace assessment. He was diagnosed with severe lower back strain and he has been recuperating well. So this workplace assessment should come after this. You can write in the second part. Okay. And write in the second part, not first. So here you can say Mr. Jones, okay, was diagnosed with severe lower back strain and has been recuperating well. Okay. So here you can say Mr. Jones, comma, who was diagnosed with severe lower back strain has been recuperating well. Okay. That's it. Mr. Jones. Now here you can say he. He requires workplace assessment. So modification. Which one should be first? Recovering afterward, workplace assessment afterwards. First tell now, first tell the past, then tell the present, then tell the future. Why are you telling future first? Mr. Jones requires workplace assessment in the beginning. First tell what happened. Then how is his condition now? Then tell what he has to do later. First tell Mr. Jones was diagnosed with severe lower back strain. Now he has been recuperating well. Therefore, he requires workplace assessment. This is past. This is past. This is present. and this is future. Don't you know that? Don't you understand that? Okay. Who is this? Simiat. Yeah, good. Right. Next, number 4. Sheenam. Sheenam is a new doctor who joined. She's a new student who joined today. Okay. And the new students, don't think I'll send messages personally. I'll add you in the group and there you can take the messages. Yeah. So I'll add you in the doctor's group, Sheenam, because you just admitted. Okay, copy. So number 4. Sheenam Bansal. Yeah. Sheenam Bansal. B should be capital letter. Okay. Right. Mr. Barry Jones. Mr. Barry Jones. Who is, that's fine, a forklift, a driver, a driver. Who is a forklift driver? So a driver, without a you cannot write driver. Either it's singular or plural, you have to tell. Mr. Barry Jones, who is a forklift driver by occupation. Why this is this necessary? Hmm? If it is not there, is there any harm? Is there any harm if it is not there? Is it not sufficient? Driver means occupation only, no? Anybody can understand, right? When anybody can understand, then why are you telling that? If I know something, and if you are telling the same thing, then I'd say, I know, why are you telling me? Driver means occupation only. Don't you know that driver means occupation? Don't I know that driver means occupation? So you know, then why are you writing that one? I also know. So why are you writing that one? There is no need. There is no need. Yeah. Mr. Barry Jones, who is a forklift driver and lifts heavy objects at work, was diagnosed with severe lower back strain. So, diagnosis, don't change the words. Full stop. Mr. Barry Jones, who is a forklift driver, okay, and lifts heavy objects at work. This you can write afterwards, no? And lifts heavy objects at work, you can write afterwards. Okay, well, it's okay. It's okay. They're also okay, but it's better in the introduction as short as possible. Okay, don't fill it with too many words. Was diagnosed with severe lower back strain. Okay, currently, whenever you use adverbs alone, okay, currently he has Currently means he is. Currently means now. He is recuperating. He is in the recuperating stage. Currently, he is in the recuperating stage and requires workplace assessment to resume his duties. That's fine. That's good. Okay, Mr. Barry Jones, who is a forklift driver and lives uh, yeah, so it's becoming little more. So how many words are there? 36 words. Fine. So there are more things which you have missed actually. Okay, fine. Next, Mr. Barry Jones, who is a forklift driver and lifts heavy objects at work. Sama was diagnosed with severe lower back strain. Currently, he is in the recuperating stage and requires workplace assessment to resume his duties. Very good. Right. So, this is the way how we are going to write the sentences. Fine. Now I'll give you some sentences. Okay, I'll correct them and I'll give you. Now 3-4 sentences I have corrected. So we have to move forward. If we correct all the sentences, maybe it will take a little time. I'll correct personally and I'll send it. Okay. Next one is Swati Nemade. Swati Nemade. So this is number 4. 4. Yeah, that is 4. Next one is 5. Yeah, Swati Nemade. Yeah, yeah. Next one is 6. Sukhwinder Kaur. Yeah. Next, Deepika Chandigarh. Yeah. Next one, 8. Tuara Rujat is a guest. Welcome for the platform. Kiran Delhi. Yeah. 9. Yes. Now let us see these sentences. Yes, Swati. Right. Yeah. Mr. Barry Jones, very good. A forklift driver who was diagnosed with severe lower back strain is being referred for workplace assessment. So he did not give anything like a referred or okay, anything he did not give. So just like requires workplace assessment. Okay, requires workplace assessment. How do you know that it's a referral letter or anything? Think about that one. Okay, if you don't have an idea, okay, then just say is being referred. Is being instead of is being referred, just say requires. Okay. Mr. Barry Jones, a forklifter who was diagnosed with severe lower back strain. So instead of saying is being referred, is there anywhere given is being referred? No. So don't take chances. No? Don't take chances. Requires workplace assessment. Finished. Otherwise, everything is fine. Sukhvinder Kaur. Yeah. Yes. This letter is being written to request regarding Mr. Jones. Sukhvinder Kaur. This letter is being written. This letter is being written regarding. This letter is being written regarding Mr. Jones, comma, who was, no, who has been, the second long time process, who has been recuperating from severe lower back strain, comma, requires. This letter is being written regarding Mr. Jones. Regarding Mr. Jones, who has been recuperating from lower back strain and requires assessment for lifting heavy objects. No. Assessment for uh, requires workplace assessment Finished. So this is enough. For lifting heavy objects at his workplace, that's not fine. Okay, he needs assessment for lifting it. He needs assessment so that he can go for job. Okay, assessment for lifting heavy objects. Okay, and suggestions. Okay, that's better. This letter is being written regarding Mr. Jones, who has been recuperating from severe lower back strain and requires workplace assessment. That's it. Or he requires workplace assessment. Finished. Next step. Mr. Jones, a 44-year-old, very good, forklift operator. A 44-year-old forklift operator who has been recuperating from severe lower back pain. Comma. So if you want to put full stop, then you remove the comma there because there is no continuity. Okay. Full stop. Comma is being just say requires. So we don't know whether it is referred or not. No, it's not given. So just say requires. Requires workplace evaluation since he intends to rejoin, resume, rejoin. Intends to resume. Intends to resume work. Intends to rejoin work after, not from, after leave. Rejoin work is enough. Yeah. Next. Yeah. Mr. Jones, a 44-year-old forklift operator who has been recuperating from severe lower back pain, comma, is being referred. So just say requires. If the word is there, better. Otherwise, just write requires. Requires to you only. Requires workplace evaluation since he intends to rejoin. Recommends rejoin. Already you have written, no? So I'm giving another word. Recommends. Resume work. Restart work. Okay. After leave. Right. Kiran Delhi. Mr. Jones, who was diagnosed with single space severe back strain, is being referred not only for workplace assessment, single space, single space. But also appropriate management is being referred for. Okay. So he is being referred for. We don't know whether it is referral letter or discharge letter. Nothing is given there. So don't take risk. Requires not only offer is not needed. Not only workplace assessment, but also appropriate management before joining of before rejoining the office. Rejoining means going back. Then on it back again. One word and now one word saved. Rejoining office. Okay, that's very good. There is one last sentence. Absafat. Okay. Yeah, I'm writing to refer. This is not a refer letter. Nothing is given, so leave it. Okay. Nothing is given. Referral letter. Yeah. So I'm writing to refer Mr. Jones. I'm writing regarding Mr. Jones. You can say instead of to refer. I'm writing regarding Mr. Barry Jones. Barry Jones or Barry Jones? Huh? Barry Jones. Okay. The Barry Jones, a 44-year-old forklift rider, was diagnosed with lower back strain. Or intense lower back strain, comma, comma, 44-year-old Mr. Barry. I'm writing regarding Mr. Barry Jones, a 44-year-old forklift driver, was diagnosed with severe lower back strain. Okay. Yeah. Yeah. Was diagnosed with severe lower back strain, comma, needs, requires your assistance for assessing his fitness to resume work and the instructions on the task he can perform. Very good. Excellent sentence. Writing regarding Mr. Barry Jones, a 44-year-old forklift driver who was diagnosed with severe lower back strain. Okay. Who was diagnosed with needs your assistance for assessing his fitness to resume work and the instructions needs assistance for assessing his fitness to resume work and needs instructions on the tasks he can perform. That's fine. Very good. Very good. Okay, that's enough for now. Srija Ravindran is the only last. Okay. Now don't submit anything else. Okay. Okay. Mr. Jones, who has been recuperating from lower back strain, requires workplace admin to restart his work as a forklift operator. That's fine. Very good sentence. Mr. Jones, who has been recuperating from lower back strain, good, requires workplace assessment to restart his work as a forklift operator. Good. That's fine. Okay. So this is the way how you are supposed to write the introduction. Quality sentences matter the most. Okay. Quality sentences matter the most. Now in this way. Now now I'm going to give you about a conclusion. So tomorrow we'll see the main body paragraph, the conclusion. Simon sir is tired today. Okay. Yesterday also I was there till 2 o'clock, so I want to sleep today early, otherwise it will be difficult for me tomorrow, so bear with me. Yesterday we conducted a class till almost 2 o'clock. Okay. The conclusion. Based on the aforementioned circumstances, or in view of the above. Okay. Based on the aforementioned circumstances. Okay. Okay. Evaluation of or evaluating based on the aforementioned circumstances, evaluating or assessing evaluating or assessing what? Evaluating the fitness of Mr. Jones. Evaluating the fitness of Mr. Jones for resuming or returning to work, resuming professional responsibilities. Yeah, like that you can write now. It is fifth paragraph. Okay, fifth paragraph. Based on the aforementioned circumstances, evaluating fitness of Mr. Jones for resuming professional responsibilities and uh, and and okay and so and 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 modification, lifestyle modifications or assessment of workplace and resume, evaluating the fitness of Mr. Jones for resuming professional responsibilities and advising suitable professional activities. Yeah, responsibilities and uh, providing education regarding regarding what suitable professional activities would be profoundly beneficial for enhancing the condition, enhancing the condition based on the aforementioned survey, evaluating the fitness of Mr. John for resuming professional employment, providing education regarding suitable professional activities would be profoundly beneficial for enhancing the profoundly beneficial for improving the based on the aforementioned circumstances, evaluating the fitness of Mr. Jones for resuming professional responsibility and provide education regarding the suitable professional activities would be profoundly beneficial to improve the condition of Mr. Barry Jones. Okay, so that's it. So two sentences. This is first sentence. In case, comma, any additional information case any additional information is deemed extremely relevant, comma, please do not hesitate to do not hesitate. Case any additional information deemed extremely, please do not hesitate to contact me. Yeah. So there's the concluding sentence. Based on the aforementioned circumstances, evaluating the fitness of Mr. Jones for resuming professional employment, providing education regarding suitable professional activities would be profoundly beneficial for improving the condition of Mr. Barry Jones. In case any additional information is deemed extremely rare, please do not hesitate to contact me. So that's it. So yeah, you can write. If it is suitable, you can definitely write. Na? Sheenam. Yeah. So we have written the main two paragraphs, the introduction and the conclusion. Right. So almost everything is done. Only we are going to the main course. Yes. So how was the session? Provide your valuable feedback. Yeah. 60 seconds. After that, I'll close the window. Yeah. So the first session is over. Sheenam Bansal. Yeah. So Dr. Sheenam Bansal, you can share your experience. You can unmute, and if you are comfortable now, you can share your experience. Yeah.
Was more than expected. I didn't expect this much.
Don't think I'm teaching too much. I'm teaching very less, actually.
Actually, months back, I hired someone for IELTS. But it was, in fact, if I would have to grade that, I would grade them one because they, in fact, they were charging a lot, but they were not delivering as even that was sufficient. But you are delivering more than expected.
Okay, can you introduce yourself to the other students?
Yes, Dr. Sheena. I am pediatric orthopedic surgeon. Basically, I'm from Amritsar.
Yeah. Okay, check your network from tomorrow onwards. There should not be any disturbance. Update your background. Increase the power of your network, GB, 5 GB, 5 GB or what, we don't know what we'll say.
But
Okay.
it was more than expected. And I don't regret even 1%.
You'll regret it now from tomorrow onwards when I shout now correcting letters, then you'll regret it. Huh?
No, sir. You are amazing.
Okay, fine. Yeah, all of you can give your feedback. Next one, Hafsa Fatima. Hafsa Fatima. Hafsa Fatima is originally from Hyderabad. She is in the UK now. Hafsa, unmute.
Hello, sir.
Yeah, hello dear. Why I joined Simon Sir's class?
Yes, really.
Yeah, tell me.
Yeah, I really liked your detailed explanation on every sentence, like even your grammar corrections and how to use and synonyms. So I'm amazed now.
Okay.
Thank you for
Right.
that.
Yeah, that's very good. That's very good. Okay.
Yeah.
Right. And next, yeah, that's enough, I think. So I'm giving you 1 minute, all of you, to give your feedback. Afterwards, we are going to, yeah, close the platform. So give your feedback, whatever you want. Yes. So hello and welcome to Seven Sentinels, all of you, those who are watching on the YouTube. Here we have one more place for doctors, and once candidate, he did not register still. One candidate asked me for admission, nurse. He did not, he said he will join today, but he did not contact me. So one more place is open for, I think he attended the session today. Yeah, but he is not there now. He attended the session, so he did not register. So his admission is pending. So if I'll contact him now, and if he's not registering, so one more place for nurses also will be there. Otherwise, the seats are filled. Okay, that's it. Thank you very much. And those who want to join for the New Year batch will start. Sorry, not New Year batch, Christmas batch. Christmas batch will start next exam. That is okay. Yesterday, 16th. Sorry, 16th. The exam is going on 16th. So 16th, those students will go off. So in those places, we'll start a Christmas batch. Those who are interested, they can join. The fees for nurses is 15,000 per month, and 20,000 for 60 days, and 25,000 for 100 days intensive program. And our session is not like others. For example, Dalvi is there. Dalvi is not there. He's tired, I think. So he paid some 17,000, it seems, and only 1 hour session, 10 days over, nothing. Yesterday he told, no? So like that, it's not like that. I'll be there from morning 8, 9 o'clock till night 12 o'clock. Sometimes even yesterday I was there till 2 o'clock. So I'll be explaining them. And it's if you are full-time study, then come to me, you'll learn better. If you are working somewhere and doing hard work and then studying, means it will be a tough job. So most priority will be given for those students who are full-time study. You can contact me. And doctor one place is there. I told you the fees for doctors is 1 month 25,000, 2 months 32,500, and 100 days 40,000. So those who are interested can contact me on my telephone number +91 98 778 67360. I repeat, +91 98 67360. And those students who write the letters, okay, today I was a little busy, so tomorrow I'll give you the corrections. And some students I told I'll give the corrections tonight. I'll call them and I'll give them personally. Personal sessions are different. These are general sessions, okay, for the students who are registered, these sessions. Thank you very much. See you again tomorrow. Thank you. Have a nice day. And those students who said they are registering, and those who paid partial amounts, or those who did not pay the amounts, please pay the amount. Don't make me ask you again and again. I'm a teacher, okay? I'm a teacher and I deserve the respect. Whatever words you have given. See, for example, yesterday from Nigeria, one student has registered, but he did not pay the fees. Okay. I take limited students. I don't take too many students. So those who have to pay the fees, please. Okay, don't make me ask you time and again. It's a shame for me asking. So please pass on. Otherwise, your admissions will be cancelled. if you don't pay. And then otherwise your discount which I have given will be cancelled. Then once I cancel, then I will not turn back. Okay, so please make whatever promises should be made. But when you make the promises, you have to keep the promise. Okay, I told you I'll give you the best training, and I'm giving you the best training. From my side, I'm doing my best. But what about you? You have to do that one. Okay, and that's it. Please, tomorrow, actually, I have to pay the rents, okay, and payments to staffs. So I need, okay, please do it tomorrow. Otherwise, either your discount will be cancelled, or those who did not pay anything, their admissions will be cancelled. Okay, so please do that one. Thank you once again, and have a nice day. God bless you. Select all. Good night.